I would now like to talk a little bit about how do we know that somebody is getting closer to the end of life? Well, there are quite a lot of signs that somebody is approaching the end of life. They become weaker, they become frailer, less able to do things for themselves. And some of the things I'm going to talk to you about are absolutely normal. They're normal for the body to gradually start to shut down as people get close to the end of life. So you may notice that the person you're looking after starts to eat less. It's a normal process as people get closer to the end of life, that people sometimes lose their appetite. Sometimes it's because of the disease process. So it might be that the disease that they're suffering from makes them feel sick or nauseous, or contributes to their loss of appetite. People might suffer a dry mouth, and so it becomes difficult to chew food and swallow it. Or they may have difficulty swallowing because of their condition. So things you can do to help are to make sure that this food is soft. Let people eat what they would like to eat. So if they just want to eat chocolate and they're very close to the end of life, that is okay. Or if it's just yogurt or something soft. You can also get high protein, soft foods, milkshake type things, which will give people sustenance but are easier to swallow. And obviously, helping people to eat frequently small amounts is helpful. People, as they get closer to the end of life, also often stop drinking. And again, that may be part of the natural process of approaching the end of life, but may also be because their mouth is uncomfortable. It's dry as part of the disease process that's leading to their death. And so important things, both with respect to helping people eat and to drink, is to make sure that their mouth is comfortable and to keep it moist using sponges on sticks to make sure that the mouth is moist and that they can swallow well. It may be a question of helping somebody put their dentures in and helping to keep the dentures clean, because that again is both critical to a person's feeling of dignity but also their ability to eat. You may notice that the person you're looking after is losing weight. And again, with many conditions, particularly cancer, that is a normal process as people get closer to the end of life, even if they are continuing to eat. And the person you're looking after and their relatives may be worried about that because they may be visibly becoming thinner, their clothes may look more baggy on them, and they may be worried about that. And if they're worried, please encourage them to talk to their health professionals, and you can alert the health professional too. If people don't eat and drink very much, they may become constipated, or they may become constipated because of the disease processes which are leading to their end of life. But constipation can be very, very uncomfortable and cause pain and discomfort in itself. So again, it's important to note whether people are managing to open their bowels, and if there are problems, to alert the health professionals, because maybe they need some medication to help them open their bowels. And certainly drinking and eating is important, but as I've said, it often reduces as people are getting close to the end of life. But trying to prevent constipation or to manage it is very important, because it can be very, very uncomfortable and cause pain to the patient, and maybe also incontinence, as they may get overflow diarrhea. Talking of incontinence, it is quite common for people, particularly as they're losing consciousness and becoming more drowsy, but possibly also related to the disease processes, to become incontinent either of urine or feces. This can be very distressing for the individual and their relatives, and you play a critical role in helping to look after them, to help to keep them clean, possibly advising on the use of incontinence pads, to keep the bed clean, to change the clothes and bed linen. And maybe the health professional may decide that it's appropriate to catheterize the patient. That doesn't happen very often, but it may happen, and the patient may need help then in managing the catheter bag. Possibly, as in the case of my mum had a stoma because she had bladder cancer, and you may actually be helping the patient with cancer manage a stoma, either for urine or for faeces. Again, it's very normal for people, as they become gradually frailer and closer to the end of life, to become weak and drowsy and spend more time sleeping. And that's normal. What is important is to ensure that they are safe, particularly if they're going to nod off sitting in a chair or on the edge of the bed, to make sure that they are safe and that they're comfortable, and just to allow them to have more time sleeping as they get closer to the end of life. Some people feel either very hot or very cold just as they're getting closer to the end of life. Of course, if they're saying they feel very hot, it's important to check their temperature, and if they have a raised temperature, to alert the health professionals. But sometimes it's just a feeling of discomfort and anxiety and feeling hot, in which case you can reduce the bed linen, perhaps open some windows, try to enable the patient to feel, or the person to feel, comfortable. Alternatively, sometimes people feel very cold as death is approaching, and again, add bed linen, increase the heating, try to make them feel comfortable, and so that feeling either too hot or too cold is not one of the things that they're suffering as they get closer to the end of life. Many conditions, particularly heart disease, some cancers, and respiratory lung diseases, cause people to feel breathless. And feeling breathless is very frightening, and people need reassurance and help and a calming atmosphere, particularly if they're having difficulty breathing. They may be on oxygen, or they may just be struggling to breathe as they get closer to the end of life. Some small things that can help are relaxation, mindfulness, creating a relaxing and calm environment. But also fans help, and sometimes those small handheld fans can help somebody who's feeling breathless to feel a little bit calmer. If a patient is really, or the person you're looking after is really struggling, again, it's important to inform the health professionals. Almost everyone is afraid of pain at the end of life. And this is the symptom that, in a way, most people who care for people approaching the end of life are most aware of. And the professionals will be able to prescribe medication, hopefully to ameliorate the person's pain. Sometimes those medications make the person more sleepy, and it's a careful balance with trying to manage the pain and enabling people to stay alert if that is what they would want to do. I mentioned a little bit earlier about difficulty eating and drinking, and nausea, feeling sick and vomiting is quite common. This may be due to the disease process. All sorts of conditions may cause people to feel sick and to vomit near the end of life. But again, this is a very distressing symptom for people, and please make sure you discuss it with the healthcare professionals. But small things you can do are sips of water, making it easy for the person to eat, moving from solid foods to liquid foods, and so on. So these are the sort of things you might expect, physical symptoms you might expect to encounter. As I mentioned earlier, people often become either depressed or anxious as death is getting close, and that may be related to fear of death itself or fear about what happens afterwards. Some of that can be managed with medication. Some is related to talking to individuals to try and alleviate their fears, to reassure them that they will be looked after right up to death, to enable them to talk to family members, to meet religious leaders if that is what they want as they approach the end of life. And sometimes people become quite delirious as they get close to the end of life, and they will move, they will be twitching, they may be seeing things, seeing visions or hallucinations, and feeling quite agitated. Again, this is a recognised process as people get closer to the end of life, and the medical staff may prescribe medication to enable them to be calmer and more confident. But please don't be alarmed if people say that they can, for example, see their loved ones who are beckoning to them, or visions of other sorts. That's quite common as people approach the end of life. And I remember my uncle, so that was my mother's brother, calling out to my mother when he was dying in hospital, saying he could see her beckoning to him. And my aunt, she was very reassured about that. She felt that that would ensure his safe passage, and he was calmer because he could see his elder sister. That was my mother. So there's a whole range of things you may experience. You play a critical role in making life more valued and more comfortable as people approach those very last days and hours of their life. And I hope this advice will both reassure you and make you feel more comfortable when you're caring for people.
I noticed there's a color. I mean, the skin color changes. It will change from the normal color to another color entirely. Sometimes something like blue, something like that, something like purple. You see them skin change, and aside from that, the breathing pattern will change. They will not be able to swallow. I could remember the client, the one I discussed, like the last one now. You know, I told you anytime I come in, you always do like this to me. But this time around, he could not do it again. But while he was on the bed going, I noticed he wanted to communicate, but so difficult to communicate. So I tried to pay attention to him to see if I can really get what he wants to say. But I can't help. But I was just, he was looking at me using the mouth. So the breathing pattern changed, difficult to communicate, difficult to swallow.
We have a lady that passed. So during that time, her feet are always cold from here downwards. Always cold, and she lost appetite for eating. Then at first she was taking soup, tomato soup.
One of the things that I notice is they feel more pain. Their pain is always severe. So, and that is why sometimes they give them morphine just to reduce the pain. And that's why district nurses come around to inject them with things that will help them manage the pain.